What do you see in this image? For me, I see Dr. Joseph Varon. He's a CCU doctor at the United Memorial Medical Center in the USA. What I'll ask you to do just now is just indulge me by thinking about this image, and let's take off some of the protective equipment. So take off the goggles, the mask, the gown and the gloves, and think about what's actually going on in this picture. A connection between two individuals. So as a district nurse, I've been working in health and social care since around about 2002. And I was interested to know more about these connections and relationships in health and social care and some of the needs and experiences of people who are accessing those services. So I spoke to people who use those services and some of the people who supported them at home. So that might be their spouse, their daughter, and some of the healthcare staff, health and social care staff that support them as well. Now, I collected my data just before COVID hit, about 2 days before lockdown started. But when I spoke to my participants, they told me that the connections that they had with people across health and social care helped them to build supportive relationships with others. Those supportive relationships promoted collaboration, not only between two individuals, but between communities, services, and wider systems, health and social care systems. However, when they couldn't connect and build those relationships, people in our research study felt less supported. They experienced increased loneliness and isolation and delayed access to disjointed health and social care services. The services that they were accessing were not always tailored to the needs of those who were accessing and delivering the services as well. But the good news is building supportive relationships positively influenced their experiences by helping them to cope with their changing health and well-being needs, or indeed their changing caring role. So these findings help us to connect the dots of well-being to better understand the needs of people who access and deliver services, putting them at the very centre of health and social care. So just to conclude, let me take you back to the image and indulge me just once more by putting on the PPE again. So put on the glasses, the mask, the gown, the gloves. Incorporating and applying these findings to health and social care strategies as we emerge as a global nation from this pandemic can help me as an individual and others to improve health and social care practice by recognising and promoting the importance of connection. Thank you.